Model for the digestive system, they could pretty much ask you the liver, the gallbladder, the stomach. The greater omentum comes off the stomach. You have your transverse colon here, ascending colon here, descending colon here, sigmoid colon. You can see the cecum, the first part of the large intestine, and all the small intestine. This right here is mostly the ileum. If we remove the lungs and get underneath the liver, we can see again underneath the stomach the pancreas running, and we can also see the first part of the small intestine, the duodenum. Going back to the stomach, we can see that the front part has the area where the esophagus meets the stomach. You have your cardiac sphincter or your gastroesophageal sphincter there. This right here is called the fundus. There's an area where there's a gastric air bubble up on here. The main part is the body. This would be the greater curvature, the lesser curvature, and at the end of it, going into the small intestine, we would have the pyloric sphincter, which takes the food at this point, which we're going to call chyme, into the small intestine. Your pancreas is also going to produce bicarbonate, which is going to neutralize the acidity of the chyme entering the small intestine so we don't burn the small intestine. We do not have this option with the gastroesophageal sphincter, the cardiac sphincter, and when some of the stomach contents go up into the esophagus, we call this heartburn. If we go underneath here, we can see again the mesentery we talked about earlier in class, and there is no good picture of the rectum or the anus. Just remember when we're talking about the anus, there's two sphincters. The external anal sphincter is skeletal muscle, the internal anal sphincter is smooth muscle. So this model could be on the practical for both digestion and respiratory.